This is a question paper discussion. In this session, we will be discussing the pharmacology questions which were asked in NEET PG examination of 2022. A patient was given IV botulinum toxin and the patient died. Mechanism of botulinum toxin overdoses. Botulinum toxin acts on a protein called as snare protein and thereby inhibit the release of acetylcholine into the synaptic cleft. So botulinum toxin, the mechanism of action is inhibition of release of acetylcholine. That is the answer. Botulinum toxin has been approved for the treatment of many conditions. These include chronic migraine, cervical dystonia, blepharospasm, strabismus. It is also used for the treatment of primary axillary hyperhidrosis, where there is excessive sweat production in the axilla. It is used for the treatment of bladder dysfunction. It is used for spasticity. It is used cosmetically to remove glabellar lines. It is also used to remove forehead lines and lateral canthal lines. Some preparations of botulinum toxin that has been approved are onabotulinum toxin A. It is used for the treatment of chronic migraine and also glabellar lines. Next preparation is abobotulinum toxin A. It is used for migraine and also glabellar lines. Another preparation is incobotulinum toxin A. It is used only for the treatment of glabellar lines. Another preparation is rimabotulinum toxin B. It is used for the treatment of sialorrhea. The reuptake of norepinephrine from the synaptic cleft is with the help of a transporter called as norepinephrine transporter, which is inhibited by tricyclic antidepressants, cocaine and amphetamines. Blockade of postsynaptic nicotinic cholinergic receptors, they are called as NM receptor blockers, used as skeletal muscle relaxants. Hemicolinium is an agent that inhibit the entry of acetylcholine into synaptic vesicle, and vesamicol is an agent that will reduce the reuptake of acetylcholine. So botulinum toxin will bind to snare protein and inhibit the release of acetylcholine. So the answer is option A. Drug of choice for paracetamol overdoses. Paracetamol, it undergoes glucuronide conjugation and sulfation predominantly. 5% of paracetamol undergoes metabolism by microsomal enzymes, and that will result in the formation of a metabolite called as N-acetyl P-benzoquinone imine. This is hepatotoxic. At normal levels, this NAPQI is conjugated with glutathione and it is eliminated. In patients who are having liver dysfunction, chronic alcoholics, and also in case of poisoning where the levels of NAPQI is very high, this glutathione will be depleted, and this will result in accumulation of NAPQI, and that will result in hepatotoxicity. So the antidote for paracetamol overdose is N-acetylcysteine. N-acetylcysteine will replenish this glutathione, which will help in the conjugation of NAPQI and subsequent elimination, preventing hepatotoxicity. There is a nomogram which is used to assess whether N-acetylcysteine is necessary in paracetamol overdose. It is called as Rumack-Matthew nomogram. If the paracetamol concentration, serum paracetamol concentration is approximately 140 after 4 hours of ingestion, this necessitates the need for N-acetylcysteine. So the other options are dopamine. Dopamine is a neurotransmitter in the central nervous system. It also acts on adrenergic receptors. Dopamine is predominantly used for cardiac failure and cardiac failure with associated renal dysfunction. Hydralazine is an arteriolar and venodilator. It is used for hypertensive emergencies. Hydralazine is also used for the treatment of heart failure. Furosemide is a high ceiling diuretic or loop diuretic which acts on the thick ascending limb of loop of Henle, where it inhibits sodium potassium 2 chloride symporter. It is used for edema. It is used for symptomatic benefit in heart failure, and intravenous loop diuretics, they are used in acute pulmonary edema. A young female presented with left-sided severe throbbing headache associated with nausea, vomiting, photophobia, and phonophobia. Which of the following drugs can provide immediate relief to this patient? So, severe left-sided unilateral severe throbbing headache, that is a typical headache associated with migraine, with associated nausea and vomiting, photophobia and phonophobia. All these indicate acute attack of migraine. So, for the treatment of migraine, there are agents that abort an acute attack of migraine, and there are agents that prevent attacks of migraine. So, the agents that abort acute attack of migraine, they are called as abortive agents, which include two groups of agents, triptans and NSAIDs. Triptans, they act on 5-HT, 1B and 1D receptors, and they are agonists at these receptors. Agonism at 5-HT, 1B receptors will cause vasospasm, and 5-HT, 1D receptor will reduce the neurotransmitter release from trigeminal neuron. The triptans available are sumatriptan, naratriptan, zolmitriptan, elytriptan, frovatriptan, and almotriptan. So, among these agents, triptans can be used for terminating an acute attack of migraine. So, the option would be sumatriptan. Sumatriptan is available as oral formulation, subcutaneous formulation, and it is also available as nasal spray. Frovatriptan is the longest acting triptan, and rizatriptan is the triptan with the fastest onset of action. Almotriptan is a triptan which can be used in adolescents. The major adverse drug reaction of triptans are increased risk of myocardial infarction. Triptans can also produce paresthesia and tingling, which is collectively known as triptan sensation. The other abortive agents are NSAIDs, which reduce the release of calcitonin gene-related peptide from the trigeminal neuron. The NSAIDs that are approved are naproxen, ibuprofen, diclofenac, and piroxicam. Topiramate is an anti-epileptic drug which is a sodium channel blocker. It is used for the prophylaxis of migraine. Flunarizine is a calcium channel blocker. It is used for the prophylaxis of migraine. It is available as a very commonly used medication which is known by the name Sibelium. Propranolol is a non-selective beta blocker. This has been approved for the prophylaxis of migraine. This session, and in this question paper, most of the questions were asked from endocrinology, especially from the hypothalamo-pituitary axis and also growth hormone and GnRH. So remember to expect these questions in future NEET examinations as well. Thank you.